All right, this week in Exercise Science Lab, we talked about the hinging pattern, specifically with the Romanian deadlift. We talk about all the human movement patterns or primal patterns. You'll see this written in a lot of different ways, movement categories. And we're talking about just breaking down integrated movement patterns like a push, a pull, a hinge, a squat, a single leg stance or step up, a lunge, a twist, a get up, okay? So all these integrated movement patterns, and we're looking at exercises for all these patterns. But that's kind of the key there. So whether you do a kettlebell swing, or Romanian deadlift, a conventional deadlift, and then whether in a bilateral or unilateral stance, we're essentially looking at the hinge. So if someone comes in, a patient or client has lower back pain, that's one of the first things you'll assess, right? As far as how their posture looks, we'll talk about their posture. And then position, what positions can they get into? Can they get into a bowing or a hinged position, right? Where my spine is nice and tall and straight, my chin is still somewhat tucked, and I'm hinging mostly at my hip, and that's the key there, right? The hinge we're talking about, like a door hinge, is your hip joint. Because of all the intervertebral discs or spaces in your vertebrae, you have potential hinges everywhere. If I hinge throughout my spine, I can flex my entire spine, my lumbar spine, my thoracic spine, versus staying nice and tall and hinging only at my hips. Now, in order to do this, I do want to keep my knees soft. Let's scoot back a little bit. And we see this a lot of times when someone hinges with a straight knee. That's often a motor control problem, maybe lacking some stability, but that's mostly a motor control problem that they have a hard time utilizing their gastrocs, their hamstrings, or quadriceps to stabilize their knees sort of dynamically, because there needs to be a little bit of a knee bend here, all right? So we're hinging at the hips, coming back up. We're doing so in the sagittal plane mostly, all right? We don't want any transverse plane torque. We don't want any side-to-side frontal plane. Sometimes you'll see someone hinge and they'll have some frontal plane movement, which means for some reason they're loading one hip more or avoiding their lower back or something like that. So you want to watch this in an unloaded phase first, right? So we go from posture to positions to unloaded patterns to loaded patterns, all right? So I like to use a PVC pipe. We can put it across here. We'll hinge this way. And then a nice cue to keep the spine nice and tall is to put the PVC pipe on their sacrum and the back of their head. All right, and the PVC pipe represents a nice tall spine. Keep those 2 points in contact as you hinge there, all right? Then we talked about your posterior versus anterior chain. Your kinetic change is how these muscles overlap, right? So in back, you have your trapezius, your lats in back, your erector spinae going down your back and mostly in the middle of your spine, going down into your glutes, your hamstrings, and your calves. That is your posterior chain. So the Romanian deadlift is going to be a posterior chain exercise. It's not that the anterior chain is not working, but it's working a little differently. So dynamically, isotonically, in kinesiology class, we're looking at the eccentric phase or contraction here, and then driving back up with the concentric phase, all right? My upper body posterior chain, my lats, my traps, my erector spinae, they're just going to stabilize my spine, contracting mostly isometrically. And then my glutes, my hamstrings, my calves are going to stretch as we go down, elongate, and then contract and shorten to pull back up and drive my hips through. All right? So there's your Exercise Science Lab, Romanian deadlift, and your hinging pattern. I think that's everything we covered for your assignment. Good luck, and I'll see you in the next video.